Let's just dive right into this because we are looking at a medical paradox so rare it might actually be the first reported case of its kind anywhere. We're talking about a 38-year-old mother of four who essentially pushed a medical team to their absolute limits.
Imagine this scenario. It's 4 months prior to her hospital admission. The patient's husband wakes up to an absolutely terrifying scene. It's 5 a.m., right at the break of dawn, and his wife is suffering from severe tonic-clonic convulsions. We're talking full-body seizures. They rush her for an emergency consultation, doctors immediately run labs, and they find her blood sugar is sitting at 44 milligrams per deciliter. That is critically, dangerously low. She's immediately rescued with IV glucose. But the nightmare didn't end there, because these severe hypoglycemic attacks just kept recurring. At first they'd strike nightly right around dawn, but eventually they started hitting unpredictably at any time of day.
Now, this didn't just happen overnight. If we look at the timeline, up until about a year ago, she was totally fine. Then these vague symptoms started creeping in: recurrent headaches, deep fatigue, a real lack of concentration. She sought medical advice, but really only got non-specific treatments. Then, 4 months ago, those 5 a.m. seizures started. Her very first major symptom was a full-blown seizure. Add in a prolonged ICU admission and endless testing, and you can understand why she became profoundly depressed by all of this.
While she was in the ICU, the doctors had to play medical detective. The absolute most logical culprit for massively low blood sugar is an insulinoma. It's a tiny, hidden tumor in the pancreas that just illegally pumps out insulin. So they went hunting. And I mean, they ran everything: a triphasic CT with a pancreatic protocol, an MRI, an endoscopic ultrasound, a PET CT scan. Because her symptoms were so intense and persistent, they even ran a gallium PET CT scan, which is literally the gold standard for finding these microtumors. And the result? Every single test came back completely clear. Absolutely nothing. So here is the massive paradox staring these doctors in the face. Her lab results showed sky-high levels of fasting insulin and C-peptide. Those are direct markers proving that the pancreas is working in overdrive, relentlessly pumping out insulin. But the state-of-the-art imaging just proved beyond a shadow of a doubt that there was no tumor. Without a tumor, what invisible force was forcing her pancreas to flood her system with so much insulin that it was crashing her blood sugar and causing seizures?
Professor Al-Alfi bypassed anatomy and looked at function. He recognized an occult, highly complex metabolic syndrome that was causing her own pancreas to misbehave catastrophically. Our patient was slightly overweight and had acanthosis nigricans, those dark velvety skin patches you sometimes see around the neck. Those are textbook classic signs of insulin resistance, a condition that normally leads to high blood sugar. But she was crashing into severe, life-threatening, low fasting blood sugar. The professor beautifully diagnoses this not as cancer, but as beta cell recklessness, an erratic, uncoordinated physiological panic. See, normally, insulin is released in a steady baseline with a sharp, immediate spike when we eat. But because of her severe insulin resistance, her beta cells were acting with true recklessness. They totally lost their timing, their coordination, and their sense of proportion. Let's track the exact pathology here. Because her body was so resistant to insulin, her pancreas couldn't mount a normal, smooth, early response to her meals. Frustrated, the beta cells would delay and then recklessly dump their entire strategic reserve of insulin into her bloodstream way after it was actually needed. It was this delayed, massive surge that triggered her agonizing seizure-inducing crashes in the middle of the night. So it wasn't a tumor hiding from the scanners, it wasn't a rogue autoimmune attack. It was literally her own pancreas, working overtime, trying desperately to overcome her metabolic resistance. By screaming so loudly to lower her blood sugar, it inadvertently caused those terrifying 5 a.m. crashes. Professor Al-Alfi applies a completely different conceptual framework. He first identifies a state of hypoglycemia on awareness. This explains why her symptoms manifested as severe psychological depression and sudden nocturnal convulsions without any early warning signs. Normally, when your blood sugar drops, your body blares the alarms: palpitations, tremors, anxiety. But because her hypoglycemia was chronic and drawn out, those counter-regulatory mechanisms completely failed. It's like the alarm system broke. Her brain just stopped sensing the drop until it reached a critical seizure-inducing threshold. This prolonged hypoglycemia deeply impacted her mental state, which is a deceptive presentation that sends doctors down the wrong path all the time. The professor points out that patients in this chronic state often show up looking disoriented, unfocused, or severely depressed. Because the standard physical alarms are missing, they get misdirected to psychiatric care, which only delays finding the real metabolic issue. Catching this requires a master's high clinical index of suspicion. The elegant solution, a simple cure for a complex crisis. Once the medical team mapped out this crazy, paradoxical chain of events, their solution was surprisingly, brilliantly simple. No surgery needed, no intense immune suppression. They just prescribed a 4-step regimen. First, profound reassurance for a family that had been living in absolute terror. Second, regular programmed exercise. Third, a low glycemic index diet. And fourth, small doses of standard insulin-sensitizing medications. This targeted approach worked like magic because it addressed the exact physiological glitch. The low glycemic diet smoothed out her blood sugar, meaning her pancreas didn't feel the need to send out massive insulin spikes. The exercise literally forced those GLUT4 doors open, completely bypassing the need for insulin. And those sensitizers? They went in and effectively unjammed the cellular locks. With the cells finally listening again, her loyal pancreas could just relax and stop overproducing. The result was an absolute triumph. Her doctors noted a dramatic response. The dawn seizures stopped entirely. Her depression lifted. A mother who had been trapped in this endless cycle of ICU visits and traumatic tests was finally able to go home, healthy and happy. The medical team even highlighted the sheer joy of seeing the smile on the patient and her husband's faces during their grand meeting. Which leaves us with one awe-inspiring thought. We know insulin resistance can cause mild reactive hypoglycemia, but pure standard metabolic resistance causing terrifying, dawn-time, fasting tonic-clonic convulsions, and then being completely cured by simple dietary changes and basic sensitizers with zero autoimmune factors involved, the exact combination here makes this a stunning anomaly. It really begs the question, have we just witnessed the very first formally reported case of its kind in medical history? This realization brings us to the core philosophy of this entire explainer. As Professor Al-Alfi said, the creator did not make any two patients identical. Therefore, clinical guidelines must be adapted to the individual, not the individual to the guidelines.